Imagine a creature so cunning that it uses other insects to deliver its eggs under your skin. Meet the botfly, the most unsettling parasite you never knew existed. Hello and welcome to today's video, where we'll uncover the revolting yet fascinating world of botflies. These tiny parasites are known for their incredibly disturbing way of life, and if you're squeamish, you might want to prepare yourself for some shocking facts. Botflies are often regarded as the grossest parasites on Earth, not just because of their appearance, but also due to the way that they invade their hosts, including humans. Understanding botflies is more than just satisfying morbid curiosity. It's about awareness and prevention. Knowing how these parasites operate can help you stay vigilant, especially if you find yourself in areas where botflies are common. So, without further ado, let's begin. Chapter 1. What are botflies? Botflies, belonging to the scientific family Estridae, are a fascinating group of insects distinguished by their robust bodies and intriguing life habits. These flies typically measure between 1 to 2 centimeters in length and exhibit colors ranging from dark brown to black, often adorned with distinct patterns. They are found in diverse habitats worldwide, from tropical forests to temperate regions. Each species adapts to their specific host animals, where their larvae develop. Unlike most flies, botflies do not feed as adults, focusing instead on reproduction. Their evolutionary adaptations include specialized mouth parts suited to their parasitic life cycle. Despite their unsettling reputation due to their parasitic nature, botflies play crucial roles in their ecosystem. Their ability to thrive in various environments showcases their remarkable adaptations and ecological significance. Now that we've identified what botflies are, let's explore their fascinating yet horrifying life cycle. Chapter 2. Life cycle of botflies. The life cycle of a botfly is a fascinating and, frankly, upsetting process. Stage 1. Adult botfly and egg laying. It all begins with the adult botfly, which, interestingly, does not feed and has a very short lifespan, dedicated to reproduction. The female botfly uses an intermediate host, often a mosquito or other biting insects, to transport her eggs. She captures the insect and attaches her eggs to its body with a sticky substance. When the mosquito or fly bites a warm-blooded animal, including humans, the body heat of the host triggers the eggs to hatch almost immediately. Stage 2. Larvae infestation. Once hatched, the tiny larvae, also known as maggots, penetrate the skin of the host, either through the bite wound or by secreting enzymes that allow them to burrow directly into the skin. This is where the real horror begins for the host. The larvae are equipped with hooks and spines that help them anchor themselves securely within the skin, making it rather difficult for the host to remove them. Stage 3. Larval development. Inside the host, the larvae create a small, air-filled chamber where they can breathe through a small hole in the skin. This hole also allows the larvae to expel waste. The presence of the larvae often leads to painful boil-like swelling known as furnicle. Over the course of several weeks, the larvae grow by feeding on the host tissue. This period of development can last anywhere from 5 to 10 weeks, during which the larvae molt through several stages, becoming larger and more robust with each molt. Stage 4. Pupation. After reaching full maturity, the larvae prepare to exit the host. They release an enzyme that helps to widen the breathing hole, making it easier for them to escape. This process can be quite painful for the host, as the larvae wriggle out. Once free, the larvae drop to the ground, where they burrow into the soil to putate. Pupation is the stage where the larvae transforms into adult botflies. This process can take a few weeks to several months, depending on environmental conditions such as temperature and humidity. And stage 5, emergence of adult botfly. The final stage of the botfly's life cycle is the emergence of the adult fly from the pupal case. The adult botfly then mates, and the cycle begins anew. As adults, botflies do not feed and live solely to reproduce. Their short adult life, typically just a few days to a week, is spent finding a mate and continuing the species. Chapter 3. How they survive inside humans. Botflies infect humans in similar fashion, with the female botfly laying her eggs on a carrier insect. This carrier insect bites a human, leading to the hatching of larvae. The newly hatched larvae then uses the bite wound to find another way to burrow into the skin. As the larvae grow, they feed on the human's tissue. They follow the same stages as we just discussed. The process is not only painful, but can also lead to other complications, making it a particularly disturbing experience for those affected. Botfly larvae have some pretty nifty survival skills as well. One big one is their ability to stick themselves securely inside their host tissue. They've got little hooks or spines that help them to stay put, making them tricky to remove without help. When it comes to food, botfly larvae are all about feasting on the host tissue. They use special juices to break down the proteins and other stuff in the body, slurping up what they need to grow. This feeding frenzy not only helps them grow, but also causes that swollen, sore feeling where they're hanging out. To dodge the host's immune system, botfly larvae use some sneaky tricks. They coat themselves in slimy stuff that hides them from immune cells, making it harder for the body to notice and attack them. Some types of botfly larvae also hang out in deep tissues, or places where there's not much blood flow, so they're even less likely to bump into the immune cells looking for trouble. So, botflies aren't just gross, they're also pretty clever survivalists. Their life cycle from egg laying to larval munching, and eventually growing into adult flies, shows how well they've adapted to their jobs as parasites. Chapter 4. Health issues. Botfly infestations in humans can lead to a range of health impacts and risks. Physically, the presence of a botfly larvae under the skin is often extremely painful. The initial symptom is the formation of the furnicle, which we discussed in the life cycle of the larvae. This area becomes increasingly tender as the larvae grow, causing significant discomfort. Potential complications from botfly infestations include secondary bacterial infections. The open breathing hole created by the larvae can become a site for bacteria to enter, leading to infections that may require antibiotics. In some cases, the larvae can cause tissue damage by burrowing deeper into the skin, which can result in lasting scars or even more serious tissue destruction if left untreated. Psychologically speaking, having a botfly larvae living under your skin can be quite distressing. The constant awareness of a parasitic presence can lead to anxiety, stress, and in severe cases, paranoia. Many people find the experience deeply unsettling, affecting their mental well-being even after the larvae are removed. Chapter 5. Detection and Diagnosis. Detecting a botfly infestation early can help in managing the symptoms and preventing complications. The most obvious sign to look for is the appearance of a painful, raised bump on the skin with a small hole at the center. This hole is used by the larvae to breathe and can sometimes be seen moving as the larvae shifts within the skin. Medical diagnostic methods typically involve a physical examination of the affected area. A healthcare professional might use a magnification to better see the breathing hole and any movement of the larvae. In some cases, imaging tests like ultrasounds can also be used to confirm the presence of the larvae beneath the skin. Botfly infestations are sometimes misdiagnosed as other skin conditions, such as boils, cysts, or insect bites. Chapter 6. Treatment and Removal. Treating and removing botfly larvae involves various methods, ranging from home remedies to professional medical procedures. One common non-surgical method is to cover the breeding hole with a substance like petroleum jelly or duct tape. This cuts off the larvae's air supply, forcing it to come closer to the surface, where it can be more easily extracted. Professional medical treatments often involve minor surgical procedures. A doctor might use a scalpel to widen the breeding hole and then carefully extract the larvae with forceps. This method ensures that the entire larvae is removed, reducing the risk of infection and tissue damage. Home remedies can include applying bacon or raw meat over the breeding hole, which supposedly lures the larvae out due to the lack of oxygen. However, these methods can be risky and are not always effective. It's generally recommended to seek professional medical help to ensure safe and complete removal. That is why it is best to prevent a botfly in the first place. Using insect repellent, wearing long sleeves and pants, and avoiding peak mosquito activity times can significantly reduce the risk. For travelers, staying in well-screened or air-conditioned accommodations can help these insects at bay too. And that is it for this video. We hope you found the information both fascinating and useful. If you enjoyed this video or learned something new, please give us a thumbs up. Don't forget to subscribe to our channel for more interesting and informative content about the wonders and, of course, the oddities of nature. And hit that notification bell so you don't miss out on any future updates. Thanks for watching.